plus patience plus professionalism plus independence plus research is equal to independent study mentorship. This equation sums up the definition of ISM. Professionalism, leadership, and communication skills. These three words are what we want to excel in. Let me begin my presentation the way we usually begin class, a TED Talk.
Books nowadays with regard to leadership communication is the concept of executive presence. What does it mean? How do you define it? And can it be taught or learned? The Center for Talent Innovation identified three main pillars of executive presence: appearance, communication skills, and gravitas. And gravitas means things like, do your words have teeth? Are you able to make the tough decisions and stick with them? One of the missing pieces, when you think about what's integrated really between the lines of broad concepts like communication skills and gravitas, is vocal executive presence, as I call it. It's the missing link. How do you sound when you're making those tough decisions? Does your delivery reinforce your message and establish the image that you want, or does it undermine it? What happens if I'm trying to diffuse a tense situation and I say, okay, everybody, just calm down now. We need to reevaluate the situation. Well, at worst, I'm just adding fuel to the fire. And at best, you may later on gently suggest that I switch to decaf. It's about how we connect. I end up working a lot with people who are preparing for presentations and for press conferences, and they make statements like, we're very passionate about helping children and improving the quality of our schools. And I think to myself, really? Because you could have fooled me. There's a claim of passion, but there's no evidence thereof. The problem is a disconnect between the choice of words and their execution, their delivery. And this creates a problem of credibility. Now, there's a historic and seminal study that looked at feelings and attitudes as a result of the consistency or inconsistency in verbal and nonverbal messaging cues. And what they found was that when they asked people to evaluate speakers as far as whether or not they thought the speaker sounded sincere, that 38% of that evaluation was based on the tonality of the speaker's voice. Tonality being things like the ups and the downs in your intonation patterns. In contrast, only 7% of those decisions were based on the speaker's words that they chose. And the remaining 55% were looking at nonverbal cues, or based on nonverbal cues like your posture, your eye contact, etc. Now, this is a study. We have to be careful because lots of people love to misquote it. And you'll hear people make grand statements like, well, 55% of all communication is nonverbal. That's not remotely accurate, and it's not what the study was talking about. But what we can take from this study and a lot of subsequent research in the area is the importance of sounding credible. Now, I'd like you to think about this in the context of how you personally prepare for some sort of presentation. Do you spend 38% of your time working on the delivery? If you're like most people, you probably spend the vast majority, if not all of your time, working on the content, your outline, your script, your PowerPoint slides, making sure you've got cool graphics and some snazzy animations, crunching your data to put into your spreadsheets. But then after all that work, we sort of wing the delivery, hoping it'll be good enough. And in the end, that's just comparatively weak. And it can undermine both your immediate goals and objectives, as well as your long-term image and reputation. The fact is, if you want to be seen as a leader, you have to sound like one. You have to demonstrate vocal executive presence. Now, a part of vocal executive presence is the ability to read an audience and identify the kind of person from whom they would be most open to receiving your message. and then figure out what that kind of person would sound like.
This TED Talk emphasizes the importance of communication skills. It accentuates one of the main focuses of this class. When we were writing this speech, we thought, oh my god, 15 minutes, so we have to cover a lot of information. But then we had to make our PowerPoint with pictures and everything, but I think it's really difficult to just come up here and present. Not everybody can wing their speech, cough, cough. But it's a talent that not everybody has, and some people have to practice it. And that's what I've learned through ISM. When I think about the beginning of this year, I think of throwing paper balls at Mr. Purtle. I think of the activities that we did as a group. It was almost like we were in team leadership. Every A-Day, with all my torturous AP classes, cough, cough, AP Physics, I waited to attend ISM. Despite the work and effort it requires, it is something I enjoy doing. I get the choice of writing something that I want to write about, not some tedious essay about pink flamingos. You juniors get my reference. The point is, the work at ISM is rewarding. I remember first making phone calls. I had my script with me the entire time. Obviously, I didn't want to mess up. However, I did not get nervous or scared. I was just like, it's just a phone call. How hard could it be? I had a bigger problem. My problem was the arrogant neurosurgeons. Every time I made a phone call, the secretary said, he's too busy for you. Well, in nicer words, but you get the point. After making about 15 phone calls, I still did not have an interview. I think being persistent was a challenge for me, following through. I'm a lazy person, and that's not what I do. When I first scheduled my first interview, I was ecstatic. I felt like I had climbed the Mount Everest. Okay, a little bit of an exaggeration, but I still overcame this and I was proud. So October 2nd, 2014, I went to my first interview. It honestly sucked. The neurosurgeon was dissatisfied with his job and he hated it. He said that there was too much paperwork, the medical school sucked, and I started doubting my topic and if I wanted to be a neurosurgeon or not. So I was just like, okay, I'm not gonna let one interview determine my entire topic for ISM for the entire year. I went to 4 other interviews, but no one clicked. Then I talked to a former ISM student who took neurosurgery last year, and she told me to contact Dr. Christopher Madden. I guess this is where networking helps. Dr. Christopher Madden is the Chief Executive of Neurosurgery at Parkland, and he also teaches at UT Southwestern as a medical professor. My interview with him went really well. He was the one. He was an amazing teacher and super laid back. When I walked inside his office, he yelled my name. He was like, Javisha, and I was like, hi, hello, sir. Like, I was kind of intimidated. Like, he's such like a high-notch like doctor, and I was the student just trying to get an interview with him. He absolutely loved his job. He actually took the initiative to teach me, and it was different from all my other interviews. I scheduled another interview with him and asked him to be my mentor. That day, I was so nervous. I was like, is he going to say yes? Is he going to say no? If he says no, then what am I going to do? And obviously, he had to reject me. So he rejected me because he doesn't work in the clinical side anymore, and he spends most of his time attending meetings and teaching the medical students. He recommended me Dr. Toral Patel. Dr. Toral Patel focuses more on like operating on the brain tumors. I scheduled an interview with her, and I met her for the first time this week. I had the same anxiety when I asked Dr. Madden to be my mentor, because if she said no, then I would be screwed. I was thinking about dropping ISM because then I would have to start all over with my contacts. I had to put those feelings aside and showed my confidence and hid my nervousness. She greeted me in a polite way, and we began our conversation. I was amazed with the fact that she went to Johns Hopkins for her pre-medicine, UT Southwestern for her medical school, and Yale for her fellowship. She spent total 16 years to be a neurosurgeon. The interview was perfect. In fact, I found out that Dr. Madden was one of her mentors. It's funny how it worked out. I asked her to be my mentor. She said, "So you just want to hang out with me?" And I said yes, and she's like, "Oh, that would be wonderful. When can we start?" I was so happy, I was relieved. Finally, a mentor who was passionate about her job, and she had a fun personality. This is how she was passionate.
This next story is two awesome tales in one. The story of a pregnant mother with a brain tumor and the two doctors at UT Southwestern who saved both mother and child just happened to be sisters. Here's NBC5's Bianca Castro.
Baby Camden is just 12 days old and Rachel Creed's miracle baby.
We had tried for a while for him. We lost a couple babies.
But excitement about the long-awaited pregnancy was briefly cut short in Rachel's second trimester. Seizures sent her to the ER. Doctors found a brain tumor.
We had someone speak to us earlier on when we first found out that I had a tumor. And he had just said to us, well, good luck trying to find a surgeon who will do surgery on you while you're pregnant.
Enter UT Southwestern neurosurgeon Toral Patel.
And her best chance of survival and surviving well and her baby surviving well was to have surgery.
And she had the perfect doctor to assist. Her sister, Shivani Patel, a maternal fetal medicine specialist at the same hospital.
They explained everything very nicely. He's just going to go to sleep, I'll go to sleep, and then we'll wake up and everything will be good.
And it was. Toral removed the tumor. Shivani monitored Camden and then delivered him a few weeks later with no major complications. A family of doctors, the Creeds say, was no doubt part of some divine intervention.
I think that it was something that was meant to happen in a very sweet way.
Bianca Castro, NBC5.
UT Southwestern Medical Center is a teaching hospital, and the neurosurgical resident who actually scrubbed in was the doctor's brother.
I'm super excited and honored to work with a mentor like her. The best part about her being my mentor is that I can still work under Dr. Madden. If I had to compare my interviews with the interview sessions that we had in the business symposium, I can definitely say the business symposium was a lot more intimidating. Because when I went in, the first guy who interviewed me, he was British, and he just came off as, I mean, I've enjoyed the interview with him, but it was kind of like, oh, you're kind of inferior to me kind of thing, so I don't know. And then came the winter showcase, and I almost pulled an all-nighter that day. Wow, it's been a long time. For my original work, I want to do something that impacts my society and gives me self-satisfaction. A huge amount of our population suffers from brain tumors, and some who can't even pay for their simple medications. Snigdha, who's in 3A ISM, is studying neurology. We both have decided to collaborate together and have a common goal for this project. We're still brainstorming and still have to ask our mentors for their ideas. However, we're thinking to arrange a fundraiser and help in a pro bono case. We would be with the patient from the beginning to the end and understand their diagnosis and treatment plans. We're both very excited and want to make this a successful project. Our journey so far has had quite ups and downs. Everyone in this class has changed so much as an individual. I know that I've become more confident, more comfortable in public speaking, and better at networking. I'm proud that I'm able to do these things with showing professionalism. Every student in ISM is able to do that, which makes us stand out from the rest of the crowd. Relating to my topic, I've also learned the stereotype of neurosurgeons being stern, serious, rude, and grumpy is absolutely wrong. They're actually very calm and normal, I guess. For my spring semester, I want to focus on making my original work a success, as well as my final presentation. As the spring semester will be over in 4 months, I just have to start thinking about college. Recently, I realized that I don't want to become a doctor anymore and want to go into the business field. Honestly, I think this is the biggest turning point in my life. Ever since I was little, I dreamed about being a doctor. There was no other option. I still enjoy the medical field and I still love it. I'm enthralled about being mentored by Dr. Toral Patel. However, I still feel I have to explore the business field as well. Next year, I will be taking ISM 2 with my topic pertaining to the business field. Finally, I want to continue on implementing the 4 words of New Year's in my life. I still want to conquer all the challenges and accept my flaws. Learning to accept your flaws is 1 step towards success and 1 step from failure. I want to continue appreciating everyone and everything in my life because the best memories are the ones that are fleeting. I want to manage my time and spend them with my friends and family. I want to enjoy my time with you guys. Our group conversation is always, it's funny, and I think it has brought us closer together. Lastly, I want to enjoy every part of my life. Work for a cause, not applause. Live for life, not to impress. Don't strive to make your presence noticed, just make your absence felt. Thank you.
You know what's on you.